Hi, it's such a pleasure to be here with you today. My name is Madeline LeBlanc, and I'm going to talk to you today about something very near and dear to my heart, Doulas, the newest member of the hospital-based care team.
Before we start, I'll tell you a little bit about myself. I have a master's in healthcare administration from LSU Shreveport, a bachelor's in nursing from Southeastern Louisiana University, and a bachelor's in biology from Belmont Abbey College. I'm a certified birth doula as well as birth doula trainer through the International Childbirth Education Association, and I am an internationally board certified lactation consultant. I've worked as a labor and delivery, postpartum, and NICU nurse, a nursing professor. I have worked both in community colleges and in universities, and have dedicated my entire career to improving maternal health outcomes. I founded Mary's Hands Network in 2023 to train and support community volunteers to be doulas in South Louisiana, and I'm actively conducting research to promote doula care and establish best practice for integrating doulas into the hospital settings. So I am thrilled to have the opportunity to share how transformational doulas can be for hospital births.
Now let's take a moment to identify the problem. In Louisiana, we have some of the worst birth outcomes and statistics around perinatal and maternal health in the entire country.
Our state ranks fifth in the nation for maternal deaths and an alarming second for infant deaths. These statistics are a stark reminder of systemic issues, including disparities in access to care, high rates of medical intervention, and a lack of continuous labor support. These are the challenges which contribute to preventable complications, low breastfeeding rates, increased risk of low birth weight, and preterm births. To address these issues, we need innovative patient-centered solutions. Doulas offer a powerful answer, providing continuous personalized support to bridge gaps in care and improve outcomes for mothers and babies. Louisiana's maternal mortality rates are 4 times higher for Black women. 59% of Black maternal deaths between 2011 and 2016 were deemed preventable, compared to 9% of the white maternal deaths. Doula care can save lives. To understand the role of doulas today, we need to explore their historical roots. While doulas in hospitals may seem like a modern concept, the idea of continuous support during childbirth has been around for centuries. Across cultures, childbirth was traditionally a community event, with women supported by family members and experienced caregivers who provided emotional and practical care. In the 20th century, the rise of the medical model of childbirth replaced this communal support with the clinical care. While this shift improves outcomes for high-risk pregnancies, it often left low-risk mothers over-medicalized and isolated from their natural support systems. Today, our increasingly fragmented society, made worse by the pandemic, has created a void in the kind of continuous support families once relied on. That's where modern doulas come in, bridging the gap between traditional care and modern medicine. Unlike the intervention-heavy medical approach, doulas provide the continuous care that most women need to give birth safely and confidently. They empower mothers, improve outcomes, and ensure a more positive birth experience. The pandemic further highlighted their importance. During this time, doulas were recognized as essential members of the care team, stepping in to provide critical support even when hospital access was limited. So doulas are not a new concept. They represent a return to the kind of personalized, continuous care that has always been essential for healthy births and strong families. The concept of doula care has deep historical roots, dating back to ancient Greece. In this era, women were known as Maiai, provided critical emotional and physical support to the expectant mothers during childbirth. These women weren't medical practitioners, but their presence was invaluable. The Maiai played a vital role in ensuring that the mothers felt comforted and empowered throughout the birthing process. They offered reassurance, practical assistance, and guidance during labor and delivery, creating an environment where a woman could feel safe, could feel supported. Their work not only contributed to the safer births, but also to more positive birth experiences. That lays the foundation for what we recognize now as doula care. This ancient practice demonstrates the enduring importance of that continuous, compassionate support during childbirth, a principle that remains at the heart of modern doula work. Childbirth has always been a deeply spiritual and communal experience for Indigenous Americans, with women playing central roles in guiding and supporting one another through this transformative journey. In many indigenous cultures, childbirth is seen as a holistic process that connects the physical, the emotional, and the spiritual realms. Female relatives and elders provide both practical assistance and spiritual guidance, ensuring that the mother feels supported and empowered throughout the labor and delivery. One beautiful example of this is the blessing way ceremony. It's a sacred ritual that honors the expectant mother and invokes blessings for a safe and harmonious birth. Symbolism from the indigenous medicine wheel often plays a role in the ceremony, guiding mothers through the stages of labor and into her new role as a mother. This reflects that interconnectedness of life cycles and the profound importance of community in the perinatal period. This approach underscores how deeply childbirth has been valued as a communal experience, with women supporting each other in ways that were both sacred and practical, a tradition that continues to inspire the work of doulas and other obstetrical healthcare workers today. Even in colonial America, women supported one another during childbirth in deeply meaningful ways, continuing that tradition of communal care. However, the early 1900s marks a significant shift as obstetrical care moved under the umbrella of medical practice. Between the 1940s and the 1960s, the use of twilight birth became widespread. This practice involves administering morphine and scopolamine to anesthetize laboring mothers. While addressing pain, for sure, this often left them disoriented and disconnected from their birth experience. In the 1960s, the epidural emerges as the safer and more effective option for pain relief, and it was considered a true lifesaver and a modern medical marvel for mothers. However, many of the impersonal and isolating practices associated with twilight birth still lingers even without it now that we have the epidural. So these practices included things like mothers laboring and birthing alone, separating babies from their mothers immediately after birth, discouraging breastfeeding in favor of formula feeding, or increasing the reliance on surgical interventions or now pharmaceutical interventions. While medical advancements undoubtedly are saving lives, they often come at a cost of the emotional and the physical connection during childbirth, which can leave many women without the support they need to thrive during this difficult and transformative experience. In the 1960s, Dr. Dana Raphael used the term doula, which originates from the Greek word meaning female servant. The story goes that in the late 1950s, while explaining her concept of maternal support to an elderly Greek woman, the woman responded, "That's a doula." Inspired by this, Dr. Raphael used the term in her 1966 dissertation on cross-cultural breastfeeding practices, and later popularized it in her book, The Tender Gift, Breastfeeding. Dr. Raphael redefined the term to describe an experienced woman who supports mothers after birth, particularly with breastfeeding. Her work not only gave us a name for this vital role, but also sparked the modern movement to integrate doula care into maternal health systems. In the 1970s, groundbreaking research by Dr. John Kennel and Dr. Marshall Klaus forever changed how we view the early moments after birth. Their studies highlighted the critical value of skin-to-skin contact between a mother and her baby during that first 90 minutes after birth. This, quote, baby-friendly environment was shown to promote bonding, reduce stress for both mother and baby, and support the development of lasting emotional attachment. As one article summarized, their findings concluded that close contact within minutes of birth was essential for forming a lasting parent-child bond. This research reshaped maternity care practices worldwide, encouraging hospitals to prioritize early contact between parents and their newborns. Dr. Kennel and Dr. Klaus didn't stop there. Their work also demonstrated the transformative impact of doulas on birth outcomes. Women supported by doulas experienced fewer medical interventions, shorter labors, and more positive birth experiences. This evidence sparked a renewed appreciation for doulas, leading to the creation of formal training programs and professional organizations that continue to elevate this essential role. Their books, including Maternal-Infant Bonding, Parent-Infant Bonding, and The Doula Book, remain foundational texts reinforcing the importance of bonding and doula care in modern maternity practices. The evolution of the doula's role marks a transformative shift in childbirth culture. Over time, we've moved beyond a purely clinical focus to embrace a more holistic approach that prioritizes both medical care and emotional well-being. By honoring the ancient traditions of continuous support and integrating modern research, doulas provide a unique bridge between the past and present. Their work creates a nurturing, personalized childbirth experience that improves outcomes for women worldwide. In the next few slides, we're going to take a closer look at the data behind these impacts, explore how doula care reduces interventions, improves maternal and neonatal health, and enhances the overall birth experience. The numbers speak for themselves, and they highlight why doulas are becoming essential members of the modern birth care team. This slide highlights just a few of the measurable impacts of doula care, so let's break it down. First, we see a 6.2% reduction in the risk of low birth weight. For vulnerable populations, especially those facing socioeconomic or health disparities, this can make life-changing differences. Next, there's a 9.2% reduction in maternal or newborn complications. These are outcomes that save lives and reduce long-term health challenges that are faced by both the moms and the babies. Doula care also decreases primary C-section rates by an average of 7.7%. With C-section births posing higher risk of complications and longer recoveries, this reduction is significant for both health outcomes, but also healthcare costs. Finally, there's a dramatic 26.5% increase in breastfeeding initiation during the hospital stay. And this is not just about nutrition. It's about fostering bonding, reducing infant mortality, and setting the stage for lifelong health benefits. These statistics are telling the compelling story that doulas are not a luxury or an add-on. They're a critical component of improving maternal and neonatal outcomes in every setting. Let's take a closer look at more recent data that reinforces the value of doula care. So this study is conducted across 3 U.S. states and provides some striking insights. One is that the C-section rate dropped significantly from 17.79 to 10.4%. That's a major improvement, reduces risk and recovery times for mothers. The preterm birth rates also saw a notable decrease, falling from 8.72 to 5.37. That's an incredible impact on neonatal health, especially as preterm births are the leading cause of infant complications. Emergency room visits or readmissions due to delivery complications decreased from 5.03 to 3.69%. And that shows that doula care can help prevent complications that would otherwise require more urgent interventions. Perhaps the most striking is the decrease in the postpartum anxiety and depression from 14.09 to 6.04%, which emphasizes that the emotional and mental health benefits of continuous, compassionate support during and after labor is impactful. This study illustrates the far-reaching impact that doulas have, not just on physical health, but also emotional well-being. It's another testament of how doulas are reshaping the birth experience for the better. Now, let's define what doula care looks like today. According to the International Childbirth Association, a doula is a trained professional who recognizes birth as a key life experience. They support the physical and emotional needs of women in labor while providing information to help a woman make informed decisions in conjunction with her healthcare providers. Doulas are experts in comfort measures, advocacy, childbirth education. They are there to empower women, helping them navigate their birthing experience with confidence and autonomy. From prenatal prep to postpartum care, doulas offer unwavering emotional support, ensuring mothers and families feel seen, heard, cared for throughout the journey. In short, doulas are bridging that gap between the clinical and the personal, bringing both expertise and compassion into the birth experience.